area and will be required to temporarily block one lane on sections of this road. CUC apologizes for this interruption, which is necessary to facilitate required overhead infrastructure upgrades to provide our customers with safe, reliable, and efficient power. For more information on the outage, please contact CUC's customer service team at 949-5200 or email service@cuc.ky.
The COVID-19 booster provides an increased immune response, which means improved protection against getting infected or transmitting COVID-19. It's the best way to protect yourself, your loved ones, and our community. It is proven to be safe and effective, and it will save lives. If you are 18 years and older and received your second dose at least 3 months ago, then you are now eligible to receive your third dose of the COVID-19 vaccine. Get boosted. Let's keep working together to protect the ones we love. Visit gov.ky/coronavirus to learn more.
Looking for service at your fingertips? You can have that with Island Heritage. You don't have to leave home to access your personal insurance or pension information. At islandheritageinsurance.com, you can request an insurance quote or make your insurance payment using your credit or debit card. If you're looking to access your pension information, you can get that too. Simply log on to our pension portal for convenient access to your documents, statements, and payments. Visit us online today at islandheritageinsurance.com.
That's the sound of a bite-sized payment I made on my new laptop.
Can I make a bite-sized payment on this amazing vacation?
Yes, with Scotia Select Pay. Now my big-ticket credit card purchases are more manageable with flexible bite-sized payments over 3, 6, 9, or 12 months at a lower interest rate. Scotia Select Pay allows me to better plan my expenses over time. The best part? No credit checks or financing application. Visit ky.scotiabank.com. Conditions apply.
Connect to the culture. So it's not nice.
Too sexy for this syrup, too sexy for your girl, too sexy for this world, too sexy for this world.
Star 927. We got what? Got you hooked like freshwater chart.
Good evening. First of all, thank you for joining us. As you know, premium content, Star FM, and with a new voice. Hopefully a slightly familiar voice, but new to the station. Today I get to drive the train. Hopefully it all goes well. I know the floral shops worked hard today, made a good profit, hopefully. And it was Valentine's Day, and I'm sure you did have a productive and extremely powerful day. I think I should take this time to send that special greeting to my wife, my own Valentine. Maybe somebody today made you feel special, or maybe not. Maybe you're still independent. Maybe you're taking time for yourself, looking for love, taking time to heal the heart. You're probably stuck in traffic, and that is a good thing. Yes, today that is a good thing because I have your silver lining. The music has come to a close. It's time to get into the meat and the potatoes. We are live. The phones are open. If you hear something that sparks your interest, give us a buzz. 943-3700. As always, a number in studio open for you. 943-3700. And today, if you wanted to talk to the person across from me, you would need to book an appointment. His time is precious. We have the pleasure of having a 1-hour slot with him, and that's probably the amount of time that you would need to go in, ask answer some questions, and maybe get some medical advice. Of course, for Medical Mondays, we have a doctor in studio, the adult interventional cardiologist from the world-renowned HealthCity is here, Dr. Rugu. Doc, good day. Doc, are you there? Check. Doc, are you there?
Hi, good evening.
Yes, he is here and alive. Of course, my name is Matt Brown. I'm here to hopefully guide the conversation. I'm here to increase the local, regional, maybe even the global awareness of the offerings of Cayman State of the Art Facility, Medical Facility, Health City, we sometimes forget that it's here. We sometimes forget what we have on our doorstep. So, Doc, I'm going to tell you exactly where I am. All right? This is where I am.
Okay.
We're live on air. My heart rate has increased slightly. Yeah.
Okay.
I feel more. I feel like blood has been pumping to my brain a little more than maybe 20 minutes ago. I'm not perspiring because it hasn't gone wrong, at least not yet. But I just want you to maybe give me some information. What is happening to my body now that we're on air and I'm vulnerable and we're out in the open? Why is my heart beating? What's happening to me?
Yeah, this could be probably related to your anxiety.
Uh-huh.
Yeah, because you are sitting, you are not doing any physical activity right now. Yeah, but still, if your heart is racing, so one of the commonest causes is stress or anxiety related issue that could lead to fast heart rates.
Stress. I mean, it's related to to worry. And when I think of it in general, but being stressed for a big meeting, being stressed over a promotion, being stressed about asking out the person you love. So is all stress. What is the point of it? Why would the body create this negative anxiety and emotion for something that is a good thing? Why would the body do that to me?
Yeah, so undue expectations possibly lead to
She's
a
gonna
lot of
tell you
stress.
no, brother. She's gonna tell you not to call her. Yeah, I'm listening to you.
Yeah, since you mentioned about Valentine's Day, so possibly or maybe cardiovascular health awareness month falls in February, maybe for the same reason. And this talk is basically to create more awareness in the public about cardiovascular health, the diseases affecting the heart and the blood vessel system, strokes, the cardiovascular mortality and morbidity.
Well, Doc,
And
we jump into
yeah,
to it deep, this is what I have come to assume is the norm. I go to the doctor. The first thing they do is every doctor. I don't know if it's only for photography or it is common practice around the hospital, but everybody is wearing a stethoscope. And this is the tool that is to me is so basic. It's so outdated. But you take out your stethoscope and you're listening to my heart. I I can listen to my own. I've played around with them in a pharmacy. What information could you get from a stethoscope that with my untrained ear I might not be able to get?
yeah, that's a good question. Actually, how much ever maybe the advancement in the field of cardiovascular sciences in terms of technology, but clinical cardiology still forms the foundation, the basis of cardiovascular assessment. So, history, as the patient walks into your clinic,
Hmm.
yeah, you see his demeanor, you take the proper clinical history, you do a proper clinical examination, and stethoscope is a tool which is actually going to communicate between the information about the patient's heart and what's there between your ears. That's your brain.
That's
So
your
you're,
ears, not my
yeah,
ears. Yours, because you have studied for
yeah,
you've dedicated 10 years of your life
yeah.
or more to try to understand what is an irregular heartbeat. So okay, you everybody talks about their heartbeat, what is normal, what is above normal. When we were expecting a child, I can't remember the BPM, but my kid's heart rate in the womb raised to, I want to say, in the 150s. They were
Yeah.
and that is probably what got us a little scared and hey, let's get this baby out. So why is it different from a child? What is different for adult? What is the elderly? Should we be counting our own heartbeat? Am I supposed to be doing pulse checks?
Yeah. So the heart rate is not a fixed entity. It varies with age. It varies with the presence of any risk factors or disease in a particular individual. It depends on the amount of physical activity. In athletes, the heart rate is usually on the lower side. That's called an athlete's heart because they have an increased vagal tone. In the fetus or in small kids, the heart rate is on the higher side. So a fetal heart rate of 160 versus an adult heart rate between 60 to 100 per minute, it varies anywhere between that. And so you have to take into perspective the overall clinical situation and then decide whether the heart rate for that particular individual is normal, high, or low.
So when I go to the gym, I intentionally increase my heart rate, and this is something that the trainer probably wants me to do. Don't start on a bench press. Get your body warmed up. What are they hoping to do?
Yeah.
If the generic term is warm up, what what's happening inside, and why is this better for me to raise my heart rate to do strenuous activity?
Yeah, when you exercise, your sympathetic activity goes up because of the hormonal changes, because of release of adrenaline. Your heart rate tends to increase commensurate with your level of physical activity. That's physical endurance. So that's what exactly happens when we are doing a stress test. Like we calculate a certain amount of heart rate that needs to be achieved while performing a stress test in the non-invasive cardiac lab, so that we get to assess the results properly. That's called a target heart rate. So
So you have your own treadmill.
yeah. So your gym instructor might be hoping you to reach the target heart rate when you are exercising.
All right. Today, you want to share with us? I know Health City not only has a state of the art medical facilities, but also a great cafeteria. So let's talk about, if we're going to take care of our body, what we put in our body, we are what we eat, etc., etc. Well, Doc, tell us the truth. What did you have for lunch?
I had veg salad and some rice stuff. Yeah, because
Rice is not healthy. You know that.
yeah, anything in limited portion should be okay. You should not be eating too much of processed carbohydrates or the so-called refined carbohydrates. Uh, yeah, there is a particular amount of the level of the contribution of each product of this thing what you eat. Like fat should be like 27% of the total calorie intake. Protein should form about 40%. So it's like you might have heard about keto diet, Mediterranean diet, and so many things like that. So it's
I
basically
don't.
about yeah.
I recently came across. Well, due to social media, we are bombarded with information, and I think we're vain. I think as human beings, we are looking at, especially to your significant other, for this state of attraction, and then with that, obviously, goes effort, and to get the results. Sure, let's starve ourselves. Let's go on. Let's cut out all of the carbs. Let's go on keto. What I see as the reality is that people try, some succeed, and then it's not sustainable, because that's not who you are. You have eaten rice every day for the past 30 years. What makes you think that tomorrow you're going to cut out rice, cut out potatoes, and you're going to make, yes, you'll drop a couple of pounds, but how are you going to sustain this lifestyle? What is your advice to everybody who is trying to lose weight? And should they be on a, let's start on keto? Should they be, is a keto diet healthy?
Yeah. There is no proof that keto diet basically helps in improving the cardiovascular outcomes, because the studies are still ongoing. Keto diet basically is a carbohydrate restricted diet. Okay, so it helps in losing weight. When it comes to diet, what I tell my patients is that eat as much as plant based products like vegetables, fruits, legumes, nuts, seeds. Eat lean meats. Don't eat too much of red meat. Cut down on the meat intake and stuff like that. So, and omega-3 fatty acids, of course, which is found more in fish. So these are some of the things. Less oily stuff, as you said, less of refined carbohydrates, and more of protein diet.
I have a problem with that, because my body does not want that. You know what my body wants? It wants bread. It wants rice. It wants fatty, sugary, good tasting food. And what you're telling me to do is to eat bitter food. And why would I do this?
Yeah.
Because you know what? On my way to work, I have to cross several excellent restaurants that their market, their idea, when they sat around and say, hey guys, I have a business idea. Let's create delicious fatty foods and let's
Yeah.
sell it to the public.
Yeah.
And the question is why, if my body wants to extend its life, if my heart wants to live as long as it can, why would it trick me and tell my brain to want things that are bad for it? What is the benefit to the heart itself? Is killing itself. The brain is killing itself. Why do I crave sugar? Why do my kids
See,
crave sugar?
yeah, the idea is to restrict your calorie intake to say about 2000 or 2100 calories per day. And to balance that, you need to cut down on these sugary beverages, sweets, excess carbohydrates, oily stuff,
Mm.
and excess of meat. That's the idea.
Well, it's
So,
discipline, and you're saying
yeah,
that this has to come
yeah,
from uh, a strong mind.
yeah.
Yeah.
Because yeah, whatever you're telling about the tasty stuff like burgers or deep fried items,
Mm.
they're only for a few moments on your lips, but they're going to be ever on your hips. Okay, so you should be careful. Watch out for that. And one of the sentinel cardiovascular disease risk factors is all about unhealthy nutrition. That's why a patient who comes to us with a heart attack, say, when we are sending them home after treatment, the most important part of the lifestyle modification is dietary adjustments. And we have an in-house dietitian who goes and talks to the patient and tells them about the do's and don'ts of eating, and we hand out a chart wherein we are based on their risk factors, we advise a modified diet regime. So diet definitely forms part of the treatment. It's not just medications and exercise and control of diabetes, hypertension, and stuff like that. But
It's
yeah,
it's more than that
it's
too,
more than
because
that.
let me also give credit to my wife and to moms in general, and probably to a lot of the women in Cayman, because I suspect that they are the ones that are doing the shopping. I suspect they are the ones that are making the choice in every aisle on what to put into the cart. The kid does not get to decide mostly what is for dinner. Maybe I have some influence, but I think moms are doing a lot of the work, and that ties into cost. You go through the supermarket, everybody has seen the increase of cost of living on their checkout. Well, what is your average, doc? How much you spend a week? You want to tell us? Is it just you? Are you single? You're looking for love?
Yeah, sure.
Yeah. All right. So a single guy.
Yeah, I'm single on the island.
Yeah. Okay. And then how much do you spend when you're buying your own groceries?
I visit the supermarket at least thrice a week. I prefer to buy fresh vegetables and fruits, and I always have some grains, seeds, and almonds, walnuts.
Mm.
I consider them to be healthy, as I was talking to you. And yeah, it's very difficult on a day-to-day basis to always have a balanced diet, but you should try to get as close as possible to an ideal diet regimen.
Yeah.
Yeah.
And cost wise, I would say easily, if I just guessed, I'd say you walk out of there with 2 bags, you spend about $50 minimum for 2 bags. If you're visiting it once a week, you're spending over $100 a week. So depending on what you make, that's depending on how good of a lifestyle maybe you could live.
Yeah.
Because what is fast, what is affordable, I don't even understand how they do it. How can you kill a cow, process the meat, slaughter the cow, butcher it, freeze it, use the energy to freeze it, right? We're talking about the cost of running a freezer, get somebody to cook it, put it in between two pieces of bread. That's a lot of calories, but that can be compared to a bunch of grapes that
Actually,
grow out of the ground. It doesn't make sense.
yeah, the food habits depends not only on the geographical location, it also depends on the ethnicity. It also depends on the availability of stuff, where you are. So it all depends on your
You grew up.
traditions.
Can you just tell me your background? Where did you grow up? What country?
Yeah, I'm from India,
Okay.
and our staple diet is like rice
Mm.
and wheat most of the times. And India, I guess, has more of vegetarians. Yeah. Mm.
Well, yeah,
Yeah.
and in the Caribbean and
Yeah.
probably on the western side, that is a growing trend. I know more vegans now than I ever did,
Yeah.
but
The world is slowly changing towards vegetarianism, and you might have heard about intermittent fasting and stuff like that. So nowadays these concepts are coming in.
well, I just want
Yeah.
to say I don't know if
Yeah.
if what I do is considered intermittent fasting, but for some reason in the morning I'm not hungry. I can run and I feel more alert if I just drink coffee or maybe if I just had fruits and veg, but nothing heavy in the morning. And depending on your lifestyle, you might feel different. But I know in the Caribbean, if you go to a restaurant, you ever seen what we call box lunch, styrofoam container?
Yep.
Okay, there's three sections in the container: two small, one big. The biggest portion of the container is dedicated to rice and peas. Okay, then the a small part, it has to be obviously your meat, and the meat might overflow, and it has to have a lot of gravy on it, and then maybe you might have chopped salad or some coleslaw, but a lot of people would substitute that for plantain.
Yeah.
So we are coming from a long history of getting more, but maybe did we need more calories in the past? Were we doing more manual labor? Were we doing more vigorous exercise? Is it that because of our modern day technology and we sit in front of a computer that we're accustomed to eating and we're not accustomed to getting the energy off?
Yeah, that's a good point. I think maybe 50 years uh, ago, yeah, people used to do a lot of manual laborer work, and maybe they were physically very active. They were not using the cars. They were going to the work on bikes, and yeah, so that possibly explains, like, why they were more healthy.
My
Yeah,
body
personally.
is okay. Are we considered apes? Are we?
Yeah, we
Yes.
have
Okay,
that's
so
evolution.
I have the ability to climb trees. I have an ability to run long distances.
Yeah.
I think the human is like the predator
Yeah.
of all of the animals. Uh, the game will get eventually he'll sprint, but we keep coming. You remember Terminator 2?
Yeah.
Liquid Metal? Remember how he just keeps on coming? That's who we are.
So physical
So
inactivity, that's the point where we were hinting at. Physical inactivity is definitely one of the leading causes of cardiovascular disease. And by that I mean a sedentary lifestyle wherein you don't take even 5,000 steps a day, or a regulated structured exercise program, like 75 minutes of intense physical activity in a week, cumulative activity level of 75 minutes, or 150 minutes of moderate intensity exercises or sports is recommended, to keep your heart healthy, to prevent vascular diseases.
what I just know that it's not the case for it's a very select few that have the discipline to go to the gym, or the discipline to get on an app, or the discipline to turn on a YouTube video and to do aerobics. So do you have any information as to what the population of Cayman might be considered obese? Is there any numbers that we can say? Is there any numbers in the United States that we can say this is the population and it's on the rise?
Yeah, I don't have the exact numbers, but definitely obesity and overweight are increasing, statistically. And then, yeah, that brings us to another point. Obesity, the waist hip ratio of more than 40 inches in males and more than 35 inches in females is considered to be one
What you
of
say
the
males?
components.
Say the males again. Say again.
Yeah, more than 40 inches
Uh-huh.
and more than 35 inches in females is considered as an abnormal waist hip ratio, and that waist circumference. Yeah, and that is considered as one of the causes for metabolic syndrome that can lead to cardiovascular diseases.
Can I also just do the polar opposite and say that there's unhealthy practices on trying to get too thin? It's not. There's probably people who suffer from an addiction to the gym.
Yes.
And okay, the guy who is on the cover of Muscle Weekly, I'm sure you've seen these photos. Their arms are abnormally large, muscles and veins that are popping out. The heart, did the heart increase? Did the heart grow muscle? Is this healthy?
Actually, athlete's heart is a different, topic for discussion altogether. But in athletes, it has been seen that due to reduction in the sympathetic tone, their heart rate usually tends to be on the lower side. Their heart muscle thickness is usually on the higher side compared to a normal person who doesn't indulge in so much of physical activity. So
Are you saying that we weren't
we,
chosen?
yeah.
Me and you
So
and I, we.
it could look like a big heart, and we need to differentiate it from some disease states. An athlete's heart may have a thickened muscle mass. So yeah,
Interesting.
yeah,
Now, I mean, we were talking about what is considered just as a benchmark, which is not anything in concrete. But I've heard conditions, I've heard terms growing up. And in Cayman, we say slang, we say, oh, she's a thick girl. She's thick, not fat, big boned. And, um, people carry their weight well. So is there any uh, truth to it? Is the bone structure somewhat thicker in some people that would add additional weight that would increase their waist size?
yeah. So when it comes to a thick individual, it depends on what is the muscle mass, what is the amount of fat, particularly the central obesity or the visceral obesity, what we call the bone contents. It depends, and so the overall thing is whether the weight is appropriate to their height. That's what
Oh,
you
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 can't be
you
you
yeah.
can't be short and thick. You gotta be tall
Yeah,
and
yeah.
thick.
If you're tall and if you're, matching to that desired weight levels, then it's fine. So
So if you are overweight, you will need a certain amount of muscle mass to. If you're going from the couch to the washroom, and let's say you're X amount of pounds, you have to have the ability to pick up this weight. Is that correct?
yeah,
If you're 500 pounds, then you would have to have the muscle strength to pick up 500 pounds to go from the couch to the bathroom. So there is a certain amount of muscle that comes along with the fat.
yeah,
And then the heart stays the same size. The heart did not increase. So it is the overworking of the heart that has to pump to all of the extra tissue to keep these cells alive, your skin,
yeah.
all of the additional muscle to keep you alive. And is that what you're saying, that is causing extra work on the heart
Yeah,
because it's pumping?
obesity, yeah, has its own disadvantages in many ways, not only on the cardiovascular system, but also on the joints, on the level of, the speed of activities that one can perform with that kind of obesity. So morbid obesity is when the body mass index is more than 40. So you might have heard about bariatric surgeries.
Is that gastric bypass?
Yeah, gastric bypass. So because it's a disease state, obesity, particularly when it gets worse, is associated with a lot of disease conditions.
Is that something that you recommend at Health City? If
Yes.
if the person,
Yeah. After see, obesity could be due to genetic predisposition. It could be due to lack of physical activities, or it could be due to improper dietary habits. And if a person tries to reduce weight by correcting all these factors, that's fine. If it doesn't work, then in that case we offer gastric bypass surgery, which is also called bariatric weight reduction surgeries. So
Now-
that's beyond a point. There are some criteria to decide on which patient goes for this kind of surgeries. It's not offered to everybody. First, they need to try their lifestyle measures. They need to improve their condition, lifestyle, to bring down the weight.
well, what you're doing is taking the stomach and then making it smaller. Is that right?
Yeah, so that you don't feel hungry. You tend to eat less because you're reducing the capacity of the stomach.
And then if you
gastric
eat
volume
less,
to-
then you lose less calories,
Yeah.
and essentially you burn more calories,
Exactly.
and you
You
lose
lose
weight.
weight.
We're talking to Dr. Raghu. He is the adult interventional cardiologist at Health City. Of course, this is Medical Mondays, and it is the month of February, which is connected to love, connected to the heart. And Health City is offering a lot of bookings and appointments for you in the month of February. If you have to consult your doctor for unhealthy nutrition practices, hyperglycemia, obesity, whatever the case. You can either email info@healthcity.ky, that is info@healthcity.ky, or simply give them a call, 640-4040, 640-4040. If you're maybe somebody in between the age of 40 to 75, you're worried about cholesterol, you're worried about something that runs in your family, you're worried about anything that is a red flag. Maybe you would like to be scanned. Maybe you want a health checkup. I would encourage you to do it this month. Do not wait. Do it this month. Again, the number at Health City, 640-4040. Just, Doc, we're going to take a break in 2 minutes. Just before the 2-minute break, we were talking about gastric bypass surgery. And I know sometimes it works and sometimes it gets great results and sometimes it does not. Sometimes the stomach can stretch again. So if there's anybody who is considering gastric and who has not come up to Health City, is there any information, any specific area of the hospital? Is there anything that you want to say that will guide them to to talk to you directly?
They need to consult a gastroenterologist, and we have the department, full-fledged department in Health City. So they need to consult the gastroenterologist at Health City.
All right. And once again, that is 640-4040, 640-4040. If you have somebody who is in between 40 to 75 years old, maybe somebody who has a history of heart disease, maybe somebody who who is suffering from blood pressure, wouldn't that be nice to give it to mommy and daddy? An appointment for Valentine's Day. Forget the flowers, forget the chocolate. Geez, listen to what we're talking about. I sent my wife chocolates today. The worst thing I could do. The absolute worst. Honey, I'm sorry. After all of this, and look what I'm doing. But that's it. We are humans, and sometimes we have to listen to ourselves. So if you know somebody, or if you are struggling from high blood pressure or diabetes, if you are, or you think that you might have high cholesterol, or you are on the verge of obesity, if you want an active lifestyle, if you want to change what you see in the mirror, and perhaps you don't know how to go about it, the professionals at Health City can give you a lot of information, and perhaps maybe medication, perhaps surgery. Who knows what your journey would be, but it is best to simply email info@healthcity.ky, info@healthcity.ky. Of course, this is Medical Mondays, Matt Brown and Dr. Raghu on your premium content FM star.
Drop the hip-hop and R&B.
This is Star 927.
Connect to the culture.
Maria is going away to college and she needs access to money, but I'm worried about her spending. Maybe I can create an alarm that goes off every time she overspends. Or I'll just move in with her. Hi, Rumi. Or just get RBC Credit Share, the RBC credit card feature that allows you to easily and safely share funds with family members for free. And you set the spending limit so you're always in control. Find out more at rbc.com/Caribbean/credit share. Special conditions apply.
It's okay not to be okay. You may be feeling a bit scared, worried, or anxious. You may be worried about your income and wondering when things will get back to normal. You may be concerned about your health and the health of your family. There's a lot to deal with right now. If you're feeling unable to cope or just want to talk to someone, please call the mental health hotline at 1-800-534-6463, Monday to Friday, 9 a.m. to 5 p.m. Caring professionals are there to listen. For more information on COVID-19 and managing anxiety, visit www.gov.ky/coronavirus.
This February, on an island where the sun glows hot and the ocean breeze blows cool, a sandwich like no other has returned. The Big King is back. 2 freshly flame grilled 100% beef patties, American cheese, crispy lettuce, tangy pickles, fresh onions, and the stacker sauce, all sandwiched between a triple layered bun. Have it your way and double the patties, cheese, or add bacon. It's the sandwich the Big Mac wished it was. The Big King, available for a limited time only at Burger King.
If you care about your car's performance and fuel economy, you'll want to fill up with the new Pure 93 at Rubis. As the highest octane fuel available in Cayman, Pure 93 will protect against engine knock, restore power, keep your engine clean, and will even reduce maintenance costs. Fuel up at your local Rubis. You'll notice a difference. Meets international performance requirements for your car. Come fuel the difference with Pure 93. Exclusively available at Rubis service stations.
They call me
Star 927.
You know what acting like it down now. Connect to the culture.
Yeah.
We are connected to the culture. We are the culture. In the studio, a Caymanian and an Indian. I'm not qualified to speak on medical matters, but he is, and this is Medical Mondays. Doc, thank you for the information. Very informative. Let's just go into a little more dangerous territory. If you don't take care of yourself, what's going to happen? If you keep on eating the way that we're accustomed to in the Caribbean, let's say, let's put on oxtail, right? Let's put on extra gravy. Let's eat it with rice and peas. Let's have it for lunch. And then for dinner, let's throw some roast beef on there, some white rice. Let's start our day with some waffles and some pancakes with syrup. Let's enjoy the mouth feel and the taste. What is going to happen? What's the end result?
So far we have discussed about nutritional aspects, physical inactivity, then obesity, and things like that, which are considered to be risk factors for cardiovascular disease. And cardiovascular disease is the number one killer in the world. And
so what are we talking? Are we saying heart attack?
Yeah, I'm coming to that. So when I say number one killer,
I
it could
dropped
be
the punchline.
it could be a heart attack, or it could be a brain stroke. And in the world there are about 18.6 million deaths per year due to cardiovascular disease alone. Notwithstanding other causes of death like malignancy, cancers, and other diseases. And particularly now in this COVID era, because before 2020 it was pre-COVID era, and after 2019 November this COVID thing happened. So COVID affects both ways. COVID can infect people who have comorbidities like heart conditions, diabetes, elderly people with lung diseases. At the same time, patients who get infected with COVID also can have more of heart attacks because of change in the thrombotic milieu in the blood vessels. So now we are talking in the COVID era. So this we need to keep in mind.
Well, there's a lot of data, whether you want to subscribe to it or not. But myocarditis, I've heard, increased hypertension, either due to COVID or linked to a vaccine, whichever way you want to interpret the data. What are you seeing at HealthCity? How many, you've been here for a few years. Have you seen an increase over COVID linked to heart attacks?
We had a couple of patients who were diagnosed with COVID and then subsequently came to the hospital with a heart attack. That could be cause and effect, or that could be a trigger in the presence of other risk factors in a patient. That's very difficult to say, but we have seen some patients of COVID coming in with heart attacks and strokes. Having said that, there are many other risk factors that we need to talk about, like as you said before, taking a break, about high blood pressure, high cholesterol, then diabetes, then old age. So how do we assess these risk factors? So prevention is better than cure, they say. Though I'm an interventional cardiologist, I also firmly believe in this concept of prevention is better than intervention.
But you wouldn't make any money, doctor, if we all took care of ourselves. We're all going to die. We all have to die of something. What is the most common killer? Are you saying that heart attacks is the number one killer?
When I say cardiovascular diseases, it includes diseases of the heart, diseases of the blood vessels. So it could be a heart attack, it could be a brain attack.
Walk me through a heart attack. Okay.
Yeah.
Now, blood is pumping through the arteries of the heart. How many arteries in the heart?
Yeah, there are mainly three arteries. On the left side, there is a left main artery, which divides into two main branches. On the right side, there is a right coronary artery. So that's just for for you to remember.
Okay, this is the main channels of blood that is flowing.
Yeah.
Now, when you get a heart,
pumps blood to all the organs in the body, but at the same time, heart also needs nutrition, oxygen, to pump. So that's why these arteries are very important. These are known as coronary arteries. A heart attack happens when there is a sudden blockage in one of these arteries.
Now,
when there is total occlusion of a vessel.
Okay, so
which
if
cuts off the blood supply and oxygen to the muscle, the heart muscle. That's
if
when it
blood
is
blood is flowing through the heart, you're saying that the fat, you're saying that something is going to affect the viscosity of the blood.
Yep.
To cause it to clot.
Yeah.
So the blood vessels are going to group together, stick together, and they're going to try to get through an opening that they used to 5 minutes ago, and this time they are not.
Yeah.
And that way, blood will stop pumping to your brain.
Yeah. Have you heard about plaque? Yeah. Have you
Plaque?
heard about? Yeah.
I thought plaque was more for the interview with the dentist, which we will do at a different time. But if it is something, it is something that is obviously probably hard and restrictive.
Okay.
So
let
go
me
ahead.
be more specific.
You tell
I'm
me.
talking here about a cholesterol plaque. Okay. So
And we,
it's-
by the way, none of us
yeah.
have plaque. Not Dr. Raghu nor myself. We're
Yeah.
extremely clean and pristine. Ready? Go ahead.
Yeah. So a cholesterol plaque is known as an atherosclerotic plaque in medical terminology. So as it gradually builds up, there comes a point where that leads to a very significant blockage in the heart vessel that's called a stenosis. Okay. And when the patient develops symptoms because of these blockages, okay, like it could be 50%, 60%, 70%. As the blockage severity increases, the patient gets more and more symptomatic. Suppose if there is a cholesterol plaque in the inside of the heart vessel which ruptures, then that attracts the platelets, the coagulation factors, and that totally occludes the vessel. And as you said, viscosity is one of the factors that gets affected. Okay, and when there is a sudden acute total occlusion of a blood circulation in the heart, that leads to heart attack.
Okay, so I just want to repeat it back so I completely walk with you on the same level. You're doing a great job, by the way, of explaining.
Yeah, I'm trying to
No,
explain
you're
in
doing
layman
fine.
terms.
You're dumbing it down. It's all right.
Yeah.
It's all right.
Yeah.
You're doing good. I cut my arm. My blood needs to clot.
Yep.
Unless I will bleed out. It's a purpose of the body to clot.
Yep.
If I have a rupture in my heart, the clotting of that rupture is necessary,
Yeah.
but is dangerous to the overall
Yeah,
picture.
when it compromises the blood flow, then that is when the problem starts.
And you're also saying that there are hints. There are you're most likely not necessary. You're most likely not to go from 0 to 100 in one day.
Yeah.
There is going to be a 30% blockage, 50, 60, and the earlier detection, the better.
Yeah.
So if I come up to HealthCity, I say, Doc, I'm here, take my money. What's the point of money other than to take care of yourself so that maybe you could enjoy it at some later point? So you might as well put some of it on yourself. I give you a couple dollars. I say, Doc, I want a full checkup. I want you to put the cameras wherever you need to go, listen, get out your stethoscope. And what's the technology that you have at HealthCity?
Yeah. As I told you, when a person walks into the hospital, we are going to assess the atherosclerotic cardiovascular disease risk factor. If the person falls in the low risk, yeah, we advise lifestyle measures. If the person falls in the high risk, we are going to advise them medications, lifestyle modification, and certain investigations to particularly screen for the presence of these blocks in the blood vessels of the heart or brain. And if the patient forms in the intermediate risk, neither too low risk nor high risk, then there are other methods of assessing the plaque burden. Okay, and in that scenario, we have this coronary artery calcium scoring as one of the indicators. Okay, and there are many tools Like we can use a Doppler to measure the thickness of the intima in the neck vessels, or we can do a blood test called C-reactive protein. But of all the markers that are available as on date, this CT scan to screen for the level of coronary artery calcium is the best. It is one of the robust measurements of risk assessment, and it also gives us an idea about the vascular age. Like you may be 40 years old.
No,
Depending on your
no, I'm
yeah.
not. I'm not.
Yeah.
I'm very healthy,
So,
and
yeah.
I'm 37. Go ahead. Yeah.
So depending on the coronary artery calcium levels, we can determine the vascular age. If somebody has a coronary artery calcium score of 20, the vascular age is 60 years. If they have 100, it is 73 years. So these are some of the methods. So in at HealthCity, we have both non-invasive cardiology setup and a cardiac catheterization lab where we do the diagnostics and interventions. So this coronary artery calcium score assessment is part of the non-invasive diagnostic workup. Other than the blood work, what we do to screen for diabetes, cholesterol, and the regular, the first question what you asked me about the pulse rate. So we do the clinical examination, we check the pulse, blood pressure, we take the patient's medical antecedents into consideration. Then we advise a heart check based on the risk levels. And stress test is one of the ways of assessing a patient's physiology. And CT coronary artery calcium score is one of the markers, for risk assessment and prediction of future cardiac events. So it is a link. Atherosclerosis is a link between the risk factors and the future clinical events. Yeah.
I want you to give me a real world scenario. Just tell me about a patient, somebody who was on the brink of maybe a heart attack in your opinion, and maybe a story that you can look back on that had an interesting curve and hopefully a good ending. Or if that person did not take your advice and did not take your medical advice, if it ended sadly, you can also share that. But tell me something, or tell me a story about one of your patients.
Yeah, I can give you two scenarios here. Say 50-year-old guy who is a chronic smoker with uncontrolled diabetes, hypertension, and abnormally high cholesterol levels, with a family history of heart attacks in his first-degree relatives.
Is he from East?
Coming with chest pain.
Mm-hmm.
Okay, and then he is definitely a clear-cut candidate who could be in that high-risk category of heart attacks. So then, how do you manage such a patient? You give all the medications, you give blood thinners, you take the patient wheel in to the cath lab, and then from ECG, from echocardiography, you know which could be perhaps the culprit artery leading to his heart attack. Then you take him to the cardiac catheterization lab, do a diagnostic angiogram, locate, identify the artery responsible for his heart attack, and do an angioplasty and put in a stent. That's called primary angioplasty.
Can we just pause just for 1 second? The artery is closing.
Yes.
50%, 60%, you make the call. You say this is a case for a stent.
Yep.
I want you to correct me where I go wrong. You're talking about something that is similar to like a spring that is going to expand?
Yes.
Okay. I want you to tell me. I lay down on your table. You have a knife and you are going to insert this stent into my heart. How do you get that into my artery? Where do you go
I
through?
access one of the vessels either in the wrist or in the groin. And more than 90% of the times nowadays, we do all the procedures through the wrist because that's very comfortable for the patient. After the procedure, the patient can walk around. He doesn't have to lie down on the bed. The bleeding complications are very minimal, and it's convenient for both the operator and the patient.
What happens to the stent after 10 years?
No, the stent is going to live there forever. It's going to stay there
What's
forever.
it made of?
It's made of...
Don't say plastic.
No, it's not plastic. It could be stainless steel. It could be cobalt chromium. It could be platinum. Okay. So, and it is coated with a polymer which has a drug coating. That's called a drug-eluting stent. That's there are new generation stents now,
so
where the chances of reblockage of the stent is very less. So.
Okay. And then in the case that you needed, I mean, I've heard of a pacemaker. So this is a device that is going to
that's a totally different
going to change and pump the blood for you. That's the worst case scenario.
Yeah. The pacemaker is indicated when the patient has symptomatically low levels of heart rate, and then you put in wires in the heart chambers and connect it to an external battery called a pulse generator. So that's a different topic for discussion. But we are here talking about mainly the cardiovascular risk factors and the cardiovascular impact. The
Well,
global
how do I
impact.
know? I think I'm healthy. I don't know what symptoms might feel like because this is just how I feel. If I feel lethargic, maybe I've always felt lethargic. How do I know? What are the red flags?
Yeah. Chest pain is the main symptom of a heart attack. Chest pain, chest heaviness, constriction, pressure like feeling, squeezing, sensation in the middle of the chest. It could be on the left, right, middle. It could radiate to the upper back. It could radiate to the shoulders and arms, to the jaw, to the lower jaw. Because many times patients with jaw pain go to the dentist and then they come back to the cardiologist because the dentist doesn't find anything there abnormal. So it has happened in a clinical experience. So a heart attack, I gave you the first scenario where a young patient, 50-year-old guy with risk factors, presented with acute severe chest pain, and then we diagnosed a major heart attack, took him to the cath lab, fixed the blockage by putting in a stent. That's called an angioplasty with stenting. The second scenario is, say, a 60-year-old patient comes with symptoms of exertional chest discomfort. The chest pain comes on only when the patient does some intense physical activity or exercise. It subsides when the patient takes rest. Or it worsens when the patient is in severe mental stress. So this is called as angina. Have you heard about this term?
Well, I mean, this is common for anybody who has not exercised.
Yeah.
I mean, okay.
So this is more stable condition, stable way of presentation. So this means that the patient has got a 60, 70, 80% blockage in the heart vessel that is compromising the blood flow in times of need.
No, you're making me worried because I'm telling you, January 1st, New Year's Day,
Yeah.
more than 50% of people in Cayman made some type of resolution to themselves. I'm going to lose weight. This is going to be my year. I'm going to get my summer body together. Barbanu, I'm coming for you. Okay? January 3rd, it's over. You know why?
New Year resolutions are made to be broken.
Because they attempted to run on the treadmill and felt out of breath, uncomfortable, felt maybe chest pain. So it is something that we have all experienced, not being able. We know what the edge of our ability. We know what that feels like. And for some people, short of breath. I see them in the gym panting. Is it a pain scale? What is it?
Yeah.
A 7 out of 10? I should go to my doctor?
Yeah, I mean, it's not necessarily 7 out of 10. It could be any kind of pain. If it is like chest pain, should not be ignored for gastric symptoms. Okay, treating a gastric symptom and a heart problem is better than missing a heart attack for a gastric symptom. That's what I always say. And second thing is, when somebody gets on the treadmill and starts doing that intense physical exercise, if they are not used to it, they may feel short of breath. But chest pain associated with the EKG changes while doing the treadmill is more suggestive, particularly in the background of the classical history of exertional symptoms and risk factors.
So you're saying that HealthCity has the ability to put you in this stressful situation to gauge, to say, is this your mind that is causing you to overthink or to overreact? Do you just need to work your way up slowly, or is this an actual problem? But it better prevention. Go and get checked out. Obviously, this is heart month here.
Yeah. So we are talking about the age group of 40 to 75 years here, who are more vulnerable, to develop these symptoms. So one is primary prevention, wherein you prevent a heart attack or stroke by controlling the risk factors. And the other one is secondary prevention, which you do after a patient has suffered a heart attack or stroke. That's called secondary prevention. So we need to target both. And here we are discussing about the primary preventional aspects of preventing a heart attack, because the global impact, the mortality, the morbidity associated with these conditions is enormous. And you were asking me about the cholesterol plaque burden assessment. Yeah. So one of the ways is to do a CT scan, which is a very simple technique. It is non-contrast based. It takes just few seconds under the CT machine, and then you can score the calcium levels. Lower score is associated with less likelihood of developing a cardiovascular event, and a high score could be associated with significant blockages, stenosis in the heart vessels. So that's how we do the CT coronary artery calcium scoring assessment.
You mentioned that there's two camps, right?
Yeah.
One, you come in, let's sort you out before anything goes wrong. Number two, you come in, you already had a problem.
Yes.
You suffered from a heart attack. That could be you coming in on an ambulance.
Yeah.
That means you could be coming in from maybe your son or daughter found you in a state. Maybe you have collapsed on the floor and they've gotten you into the car. How do you know you're suffering from a heart attack?
Yeah, so you should not ignore the chest pain symptoms. Any chest pain, usually majority of the patients present with chest pain, except severely diabetic patients and elderly patients and some, women may not have classical presentation of a heart attack. But a typical heart attack is the one wherein you have a chest heaviness, chest discomfort, chest pain radiating to, as I told you, the arms or jaws or neck or upper back with profuse sweating, lethargy, fatigue, palpitations. These are some of the manifestations.
Is there any advice that you could give to maybe somebody's taking care of an elderly person, and in the case, heaven forbid, that they saw them suffering from what they thought was a heart attack? Do you elevate the head, the legs? Do you try to get them into the car? Do you is it better to wait on the ambulance? How much time before
It's better to just call 911 and reach the hospital at the earliest with cath lab facilities. That's the best thing to do in the presence of a severe heart attack. And but if you have aspirin at home, aspirin beneath the tongue, that's one good step. But if you don't have any means of measuring the pulse rate or the blood pressure, it's dangerous to give some nitroglycerin sprays in the presence of low blood pressure, because that's going to worsen the blood pressure. So it's better.
What was this nitroglycerin?
As you said, the heart vessels.
Yes.
When they constrict, there is decreased blood flow to the muscle. So nitroglycerin is a dilator of the blood vessel, which will keep the blood flowing even in the presence of stenosis, a significant blockage. Right? But this medication has to be given with some precaution.
So if you call the ambulance, they're most likely going to take you to the HSA.
Yeah.
And if
to any clinic or any physician.
And does HealthCity work with the HSA? Suppose I want to go to HealthCity. Suppose I hear about the world-renowned Dr. Raghu, and I said, listen, I want his medical advice. Am I supposed to tell that to the person in the ER?
No, the doctors at HSA would decide where the patient is going to be referred to, and they immediately call us. They inform us that they have a patient of heart attack in their emergency. Then we activate the cath lab, the cardiac catheterization lab, where we do the procedure. And then as soon as the patient comes, we receive him in the triage, do all the necessary investigations and the first aid, the medications, and we immediately wheel, because here time is muscle, and there is something called golden hour, the window period from the onset of clinical symptom to the point of medical contact. The lesser the time it is, the better. That's the golden hour. Okay, the first hour is the best, and unfortunately the first symptom of heart attack could be death, and nobody wants to see that in this advanced where the advanced technology is available, where you can pick up the phone, just inform 911, get into the ambulance, get into the hospital as quickly as possible, and get the block fixed. So that's one scenario.
Well, okay, let's say I come and I take advantage of your world-renowned medical facilities in East End. What am I going to get for my money? Take me through my first checkup. I go to my insurer. I say, listen, I want the full works. I want you guys to check every orifice, every vein that you can find. I want to know, I want a full body report. What do I get at HealthCity? Value for money wise?
Yeah, as I told you, the atherosclerotic cardiovascular disease risk assessment is the one which guides the clinician to advise or prescribe investigations to that particular person seeking medical advice. You don't do CT coronary angiogram in everybody. You don't
Wasted money.
Yeah, because we have to assess the risks and benefits of any procedure, of any investigation. And as you are talking about value for money, that is why we have these risk factors to guide us make a clinical decision. And sometimes it has to be a shared decision between the patient and the doctor about what test needs to be done to figure out if you have any heart blockages, if you have any other diseases. And these are called the screening tools, the screening tests for diabetes, for cholesterol issues, for traditional and non-traditional risk factors. So based on the level of risk, we are going to advise you. If you fall in the borderline category, the borderline risk, then we advise you some more tests. And have you heard about statins?
Excuse me? Stalin?
Statins.
He was a dictator.
Statin.
Statin. Static.
Statin is a drug. So the statin is a cholesterol reducing medicine. So when we do additional tests, we can actually decide upon prescribing certain medications. Okay. So this is how it works. So we don't prescribe every test to every individual.
And I just want to tell the public that it is like you said, there's a golden hour, there's a golden month. The month is February. This month, HealthCity Cayman Islands is offering a promotion of calcium scoring screening tests with a consultation from a cardiologist to review the results for a special low price of $50. That is $50 to walk in and to get face to face with a doctor to look at the organ that has been pumping since birth. Like I said, in the womb, 150 BPM. And right now, I should go in and get her checked out. She hasn't been to the doctor in 2 years. She's doing well. $50 gets you, and that is only for the month of February. If you're in the range of 40 to 75, I heavily encourage you to get checked out. If there is somebody in your family who has suffered from heart disease, high blood pressure, high cholesterol, if you may be obese, even if you're not, if you think that that you're living an active lifestyle, why not just get it verified? $50 allows you to walk in and out of HealthCity. You can you can email info. Don't info email. It's email, info@healthcity.ky. That is info@healthcity.ky. Or you can call 640-4040, 640-4040. Doctor, this has been very educational. I want to thank you for your time and thank you for bringing your expertise to Grand Cayman and to share it with all of my family and friends and the Star audience. Is there anything that is on your mind that you wanted to get across that maybe I didn't give you the opportunity to get across?
Yeah, 2 points.
Here we go.
Yeah. Yeah. So you mentioned about the CT calcium scoring.
Yes.
So some people in the audience must be wondering if it is associated with any risk, okay, of exposing themselves to CT scan. The radiation dose is very low with advanced CT machines. It is less than an X-ray mammogram. So need not worry about the radiation. As you said, cost is also not a problem, I guess, because it's only 50 Cayman dollars. And the third point is you also get to see some incidental findings of something in the lungs, in the structures surrounding the heart. So that's an advantage here. The only thing is that patients who don't have excess calcium can also suffer from heart problems because the cholesterol plaques that are not calcified may not be seen on the CT scan. So that does not mean that they may not have heart problem. That's one limitation here. And the other point, what I would like to say is it's all about the lifestyle. It matters. Eat healthy and think healthy and live healthy. That's what I would like to sign off by saying this. Thank you for having me here and giving me this opportunity.
Well, Doc, thank you. And thank you for your expertise. I just want to remind the public that you know your body best. I advise you to take care of it the best you can. Sometimes in the Caribbean, we always go to tea. Drink some tea. Drink some fever grass tea. You'll be all right. No, sometimes you need serious medical intervention. And we are fortunate and blessed to have HealthCity a short drive away. And for the month of February only, $50 gets you your consultation with a cardiologist. Thank you all for listening. I hope it's been informative. Doc, like I said, this is my first time driving the board. I don't think we had any
You
big...
did good.
Yeah, I think it was all right. Keep it tuned to Star FM Premium Content.
for the people.
Killing with the slow flow.